Hello and welcome to my webinar, Is This Perimenopause? So this is all about whether you are just peri-curious and starting to explore the perimenopause journey and wondering what's ahead for you, or whether you are already neck deep in symptoms and wondering if this is all normal. So that's what this webinar is for, is just a brief overview of what perimenopause is all about and how to stay well as things change. So today we're going to talk a little bit about, I just want to introduce you to myself if you haven't met me before. I want to talk to you about hormones, what's normal and what's changing, and how those changes are impacting your mind and your body. And I just want to give you a few top tips for maintaining your health and well-being as things are changing, and to let you know the support that I offer during this time if you do need that help. So first of all, a little bit about me. So I'm Mel. If you haven't met me before, I've been working as a physiotherapist for 27 years, but I moved into the holistic wellness space because it just made sense for the kind of work that I was doing, which was with people in chronic pain, because you can't address pain or health and wellness or perimenopause or any of these kind of whole of body and mind experiences without looking at all the aspects of health. So I work with movement, nutrition, sleep, and mindset, because you can't sort of just have a good diet and exercise if you haven't got your mind in the right place as well. So from my physio experience, I evolved into a health and wellness practitioner, and I'm working in the perimenopause space because that's where I am, and it just made sense to do that. And I just love helping women stay well so that you don't give up on life at this time. So, and my business is the Health Shift. So welcome. So let me tell you a little bit about hormones. So hormones are the messengers and communicators in our body. Hormones communicate with their specific cells via specific reception sites. So what happens is a biomechanical reaction occurs inside a cell that either creates a response from the cell, or it sends another message to create a response elsewhere in the body. And hormones are involved in pretty much everything that happens: reproduction, sexual differentiation, growth and development. It helps maintain homeostasis, which is the kind of the regulation of all your body systems, and it regulates metabolism and supplies nutrients to the body. So these messengers have a really widespread role in your body, and they're a feedback loop. So if you've got more of one hormone or less of another, that will send a message to create more where it's needed, or to reduce some where it's in excess. So there's this constant feedback of hormone levels to keep things regulated and keep things nice and even. And it's a very complex system, but it does impact pretty much every system in your body. So estrogen and progesterone and testosterone are the normal hormones that we have as women. So estrogen is produced mainly in the ovaries, but there is also some in the adrenal glands, in your fat cells, and in the placenta if you're pregnant, which most of you watching this seminar won't be. Estrogen has a role in puberty and in menstruation and pregnancy, and it has a very big role in perimenopause and menopause. Estrogen influences the brain, your cardiovascular system, the integrity of your hair, skin, muscles, bone, urinary tract, and even your gut. So it has a really widespread effect on your body. And you'll notice that there's a normal fluctuation of estrogen across the menstrual cycle, as per this chart here. And it's at its when it's at its lowest point, the levels in your blood are very similar to the levels in menopause. And that's why having a blood test throughout your cycle is not necessarily helpful to indicate where you are in your perimenopause journey, because it could be that you're just at a low point in your cycle, or that you're having some erratic estrogen and it's just not showing up in a blood test. So when we look at perimenopause as a diagnosis, we tend to look at symptoms and age much more than we do just the levels of hormones in your body. I'll talk a little bit about progesterone. It's also produced by the ovaries after ovulation and by the placenta when you have one, and it prepares and supports pregnancy. So we don't really need it much anymore, but it is still part of our regular cycle. And testosterone, produced by the adrenal glands and ovaries, has a role in sex drive and regulating the menstrual cycle, but it also has a role in muscle and bone health. So a healthy menstrual cycle depends on the co-regulation of all three of these hormones throughout the cycle. So levels of one influence levels of another, and they all cooperate to give you the cycle that you need. But what happens during perimenopause and menopause is that estrogen starts to decline, and that sets off a whole chain reaction in the feedback loops where the brain starts to panic about falling levels and it overcompensates. But it also, rise and fall in one hormone impacts the rise and fall in another, and that's how things can get very messy. Um, yeah, so during perimenopause, the thing is that the decline in estrogen is not just a linear decline. You don't just have this lovely gradual drop of estrogen over a number of years. Because of that kind of response of the brain to say, oh no, estrogen's falling, let me produce more. And you actually have quite an erratic up and down levels of estrogen. So although the trend is in the direction of declining, the up and down is what creates so much chaos in our system. Because estrogen does impact every system of our body, that chaos that's created by the up and down levels tends to cause havoc in the body and mind, and for some women more than others. And we're going to talk mostly about that chaos. It's not really important whether it's just estrogen declining or what's happening with your progesterone or what's happening with your testosterone. If you just understand that the chaos that's created impacts all three hormones, it's just that estrogen tends to be the most dominant one and it tends to have the biggest impact. But if you're seeing a doctor for more menopause hormone therapy to support you during this time, they could be looking at any one or all three of those hormones in order to help support you through this time. Okay, so perimenopause, the onset is when you start running out of eggs, basically. And so there's less production of estrogen and testosterone by the ovaries. Natural menopause occurs when you've run out of eggs completely, and it's defined as being 12 months of having no period. This is common from the mid to late 40s, with an average age in Australia of being age 51. Induced menopause, however, can happen if your ovaries have been removed or damaged, which can happen during chemo or radiotherapy. And we call it premature menopause if you're having menopause before the age of 40, which is usually due to genetics or to being induced. The reason, so there we go. So, as I said, while estrogen's not the only hormone that causes all the chaos in perimenopause, it's usually the first part of the chain reaction that creates disruption, and it's the biggest player due to the number of different body systems that estrogen impacts. So you can see here neurobehavioral, genitourinary. We're going to go through each of these one at a time, but estrogen really does impact pretty much every system of your body. So now, the neurobehavioral symptoms is what makes women feel like they are just going crazy. Often the stuff that happens at this time is blamed on stress because we've got lots of demands on our life at this time. We've got this care squeeze between looking after your kids and looking after your parents. Your partners or husbands may be placing extra stress or demands on you. You're usually more advanced in your job and you're still trying to keep up the pace of your energetic 30-something self. And this all impacts your health and well-being, and it goes hand in hand with what's happening hormonally. So it's not important to separate out what lifestyle factors are impacting you compared to hormonal factors, because managing it through lifestyle and medical input where needed is what we do to deal with both. So the things that can happen with neurobehavioral changes, you can have problems with your sleep. You can have problems with your memory, word finding difficulties, which is what I have, moodiness, or any pre-existing mood or like something like depression or anxiety can be exacerbated during this time. Same with neurodiversity. If you've lived perfectly well with ADHD throughout your life, but you might find at this time that you're just not coping anymore. The strategies you used to use aren't working. And a lot of women get an adult diagnosis for the first time during this time of life because the symptoms become so exacerbated. So there can be a lot of problems concentrating, and this can also create not just a loss of motivation, but a loss of self-esteem, because you start to question your own sanity and integrity, and that can impact your work as well. Libido can be down, although some women have an increase of libido at this time. But basically, at this time of life, the main thing a lot of women talk about is just this exhaustion, because things are not working smoothly and you're not sleeping well and everything becomes just all too hard. My top tip for this particular symptom of estrogen loss is to prioritize your sleep. That sounds easy, and I know that it's not, but there's lots of things that we can do to help with sleep. That's one of the things that you could work on with me. But if you can, do whatever you can to get a good night's sleep, because that will have a flow-on effect to all the other neurobehavioral symptoms. Genitourinary problems are also really common at this area. So anything can happen down there. It can shrink, it can go dry, it can be itchy, irritated, heavy, burning, painful, and you can have infections, you can have leakage. There's a whole bunch of stuff that goes on. The top tip that I have from a pelvic health physio, she just says, estrogen gel for everyone. So talk to your menopause hormone doctor or your pelvic health physio if you are having problems in this area. Use of lubricant is another common way of dealing with this. Cardiovascular symptoms. So what can happen is that you start to have a bit of an irregular heartbeat, or little, for me, it feels like a fluttering that I have at certain times of the month. And because of the loss of estrogen, the risk of heart attack or stroke increases for women, and we actually catch up with men at this time of life where they used to have a higher risk than us. And the really main thing that I want you to do, if this is an issue for you, is to have your heart checked. We should all be having our heart checked if we're having any symptoms. We never want to assume that perimenopause is the cause of everything. There's always a chance that something else is going on inside, and you really need to make sure that that's cleared off by your doctor before you can be confident that it's just a hormonal variation. Now, the vasomotor system is the blood vessels dilating and constricting, and that's what causes the hot flushes and night sweats. Night sweats are actually just hot flushes that happen at nighttime. This is one of the most common symptoms in perimenopause, and it's often the thing that women seek help for because it can have such a big impact on your health and well-being. I've lost my place. I do use notes because my memory is not as good as it used to be. So hot flushes and night sweats. This is one of the things that women usually will seek menopause hormone therapy for, because it has, if you're not sleeping well, if you're waking up drenched, it impacts your whole health and well-being. You just can't function in the day without a good sleep. 75% of women experience hot flushes or night sweats, and it's the thing that menopause hormone therapy is the most effective for. And I'm not advocating that everyone should have menopause hormone therapy, but it is something to consider in the mix. From a lifestyle point of view, my top tip for managing this is to cut down or out the alcohol. Alcohol also causes vasodilation. So when you're already having difficulties regulating your blood vessels, reducing or cutting out alcohol will have quite a profound impact, not only on hot flushes and night sweats, but quality of sleep as well, and nutritional absorption. So this really is the time of life to start reconsidering the role that alcohol has for you. So musculoskeletal things, as a physio, this is one of my areas of expertise. When you are losing your estrogen, it can cause quite a few effects: aches and pains, joint stiffness. A lot of women get injuries at this time. Tendons in particular are vulnerable because they tend to be have a lot of collagen, and collagen starts to disappear. Osteopenia is a thinning of bones, which occurs from this time of life onwards. We lose muscle bulk, and you just get lots of niggles, and anything that goes wrong does not recover like it used to in your 20s and 30s. So I advocate for daily movement, but my top tip in terms of exercise is to start to incorporate some strength training in your weekly exercise. Loaded exercise where you're putting resistance through your muscles and bones is really important for managing this time of life. Now, for women who find it very daunting, the thought of picking up a weight, that's okay too. When I work with you, we start really simple with what you do feel capable of achieving, and we have working towards resistance work as an ultimate goal for your health and well-being. It just might not be the starting point for you, but it's something that shouldn't be ignored. So, metabolism and fat is a really hot topic because you've got less muscle, your muscles are thinning out at this time of life. You're going to have more fat because muscle burns more calories than fat, even when you're doing absolutely nothing, or if you're doing nothing different with your diet and exercise. You'll notice that because estrogen regulates the distribution of fat around the body, that as estrogen declines, fat will be deposited around the heart and organs instead of around the hips and thighs. And that can happen whether you are changing your diet and exercise or whether everything stays the same. Your body composition will change. This can also lead to factors such as insulin resistance or prediabetes or thyroid dysfunction. So it's important to have these things checked out as well. Have a blood test with your doctor, not necessarily looking for hormone levels, but just looking for those diabetic risks and thyroid function. So, as well as regular exercise, this is a good time of life to have that blood test and make sure there aren't other risk factors taking hold. But the most effective strategy for weight management at this time of life is healthy eating. My top tip is to focus on protein. Protein not only feeds your muscles and other body tissues, but it keeps you feeling fuller for longer, and it helps in the regulation of a range of other hormones in your body to keep things calmer. And at this time of life, not only these main things I've just gone through now, but the whole lot of other stuff can happen. Period changes are one of the most obvious signs of perimenopause, and they're a direct result of the disruption of estrogen. Women can experience heavy or light, longer or shorter, less often, more often, totally erratic, spotting, flooding, you name it. Period changes can also be influenced by gynecological issues such as endometriosis or PCOS. And if you feel like something's wrong in that area, just get it checked out. It's never harmful to have things checked out because although perimenopause can explain a lot of things, you don't want more important or deeper things going unnoticed. You're just brushed off because of perimenopause. You do want to check those things out too. Changes in collagen influence the health of your hair, skin, gums, nails. You can even get facial hairs because of the changes of testosterone regulation. Digestive issues can occur. You can get new allergies or intolerances, lots of fartiness, constipation, indigestion, all these joys that we can have at this time of life. And there are many, many symptoms now being recognized as part of the experience of perimenopause, whether caused purely by the hormonal disruption or whether by the impact that all of this disruption has on our health and well-being and the lifestyle choices that we make as a result of feeling not so good. So, nutrition is one of life's absolute best medicines. This is not the time to be avoiding sugar or eating clean or going low carb or keto or any other fad diet. It's better to have a clear plan to return to a healthy, balanced diet rather than try a fad, because that's what's going to carry you not just through the next few years, but for the rest of your life. Whereas these short-term diets, you might help shift a little bit of weight, but it's really not going to make a difference in the long run if you're not adopting more sustainable, healthy eating habits. So, this is a time of life where things do tend to get busier at the same time that our systems are screaming for us to slow down. What I hate to see is that the pressure builds up so much that women start to give up. They give up on that walk that they used to do on Monday mornings. They give up on resisting the biscuits in the tea room. They give up on sleep because they just can't fit everything in. And sometimes they get so burnt out that they give up on work itself, either reducing the care factor, reducing their hours, or giving up the job altogether. So I work with women at this time of life to make sure that they engage in a healthy, balanced life, fitting in the things that matter the most and spending less time and energy on things that don't matter. We work within a framework that I call food, fitness, and freedom. You can work hard on your food and fitness, but without the freedom, you are still at risk of burnout, low mood, and dissatisfaction with your life. So freedom is a permission to put yourself first and make decisions that serve your own priorities and values instead of everyone else. It's often these shifts in mindset that create the biggest changes in your health and well-being. So if you do want to work with me, what I do is a perimenopause insight session. If you scan that QR code, it'll take you to a calendar invite where you can book a time. It's $297 for that session. And what you get is 90 minutes where we talk through what symptoms you're having. I'll send you a pre-assessment symptom checker as well. We'll talk through what it is that you experience and what part of that might be attributable to hormone chaos and what lifestyle factors really could do with some intention to try and improve your symptoms and your well-being and your ability to get through the next 2, 3, 4, 5, maybe 10 years of perimenopause and come out the other side feeling well. So that's a 90-minute assessment where you learn to understand your symptoms and reflect on your health as it is now. You will come up with a plan for what you want to do with some guidance to change your movement, nutrition, sleep, and or mindset in order to improve your health and well-being. And I will give you a written plan for that. So you've got something to work with to help direct you towards improvements in your health and well-being. It also includes a 15-minute chat or a text chat if you check if you prefer a week later to make sure that you have actually started with that plan. And you may choose off the back of this 90-minute assessment to work with me. I do have a coaching program to actually help you implement all of the things that we put on that plan. So whether you want to go it alone after your perimenopause insight session, or whether you see the value in having support to implement all the changes over a period of time where you can actually be carried through and accountable for the changes, will be up to you. But the first thing to do is to book that perimenopause insight session, have a talk about what's going on and what you need to do today to start making a difference for yourself. I'm open to conversation. If anyone would like to email me through my website, www.thehealthshift.com.au. Happy to have a chat anytime. But thanks so much for listening. I really appreciate your interest in this topic and staying to the end. And I hope that you can learn more about what to do to stay well. See you later.